happens. Okay. Do I need to get rid of the thumbnails there on the left?
Well,
Or do you see that?
get rid of this stuff. Go to slideshow, and then it'll take you
Oh,
to
that's right. Slideshow. That's right.
right. And then when you do that, then
And
it'll
then
go
just
to go.
from beginning. Okay,
There
how's
you
that?
go.
Now I have the thumbnails of the people on the side. How do I get rid of that?
See, all I see is you. Oh, the thumbnails of
Well,
the people. Oh,
I see me, you,
yeah.
Joel, Dr.
Uh,
Nario, Carol.
well, if we all
I don't
close,
know how
if we all close our video, you won't see us. See, there we go.
to. It'll just be a bunch of blanks, so it'll still kind of
No, it's
kill my verbiage.
if you close your video, then it goes away.
Usually there's an X somewhere for you to exit
Yeah, I
out.
was looking for the X. Okay, there's a. Okay, well, it's on the top now. Is that so? My sharing. You don't see my screen now, though, right?
Yeah, we see it.
Yes, we.
Yeah, we got
I don't see it.
current professional memberships. That's what we see.
I don't. I don't even see it.
Interesting.
Yeah, I must have done something wrong. You are sharing. Let's see my screen.
So unshare
Okay,
and reshare.
I kind of see it now. And then advancing it, just click on it and it advances.
Yeah, down at the bottom left, there's usually is where you click on it.
It says audio, video.
No, down there at the bottom of the slide, not that far down.
Bottom of the slide.
It'll be like a little
Okay,
arrow, or
no,
or
it's
or you
not.
or you can
It's
hit
not there.
return or hit return.
Just return on my keyboard.
Yeah, or enter. Yeah.
Enter. Oh, okay. Let's see. Nothing happens. You know, and I've done this before, and I'm always a moron at this.
Yeah. Well, if you go down, like I said, usually at the bottom left is where how you advance it.
Yeah, I have nothing, and then the current slide isn't even complete. Part of it's blanked out, so I did something wrong.
Try the up down arrows on your keyboard.
Nothing. I
Or
hit something.
try to slide to the left or the right. See what that does.
What do you mean?
Just on your. Well, I'm on an iPad, so I just
Oh yeah, no, I can't do.
touch.
Dr. Quinn, just exit and come back in.
Okay.
Good
Leave
idea.
meeting completely.
Yeah, no, exit the slides and come back in. Yeah.
I think he left us. he took it to the next level, Dr. Tano.
Yeah.
be-
So what?
Well, he's from Vegas, so it's probably like 100 degrees right there right now.
He's wearing a shirt today, at least.
I
Usually
know, right?
usually he's not wearing.
Right?
Yeah. Okay. So in the meantime, Dr. Tano, what's going on with the Research Society?
Well, as you know, Dr. Burgess is not doing well. This weekend, we're looking forward to meeting him and do the conference as he wanted us to do. But now that he's sick, I don't know what is going on.
Well, the discussion was to
May I
postpone it.
speak? May I speak?
Yes.
Yes.
May I speak? I just got off the phone with John, and it's still a go ahead.
Dr.
Wow.
Burgess said, go ahead. Okay. So how is he doing?
He's doing well. He's getting better each day, and he said we're 100% on. Being a pilot, he said you don't abort a plane when it's up in the air.
Okay, so
I said I got it. Kathy
tell
and I
him
are going to
to-
be there.
yeah, tell him to talk to Dr. Ben and Dr. Quinn. For me, I can go either way because I haven't canceled my flight yet. So we can, potentially, if they're in agreement, and I think Dr. Dimitri also may be able to make it. So he's already in the area. So if that is what his wishes are, we could probably make it happen.
Okay. Well, Ben
I
is going to be
just
on.
got
Can't
off
talk
the
to him.
phone with him. I just got off the phone with him. It is a go. So please
Okay.
make plans to be there. If you
Okay.
were going to, it is happening.
Still got all the plans already set, so that's good. Now, can you guys hear me?
Yep, we
Yes,
hear
go
you.
back to the slides.
Okay, so I'm going to hit share to share my screen.
Right.
And oh shoot, my slides aren't up. I'm so electronically challenged, it's sad.
So open the PowerPoint first.
We'll open PowerPoint first, so I have to.
Right.
I'll minimize this thing,
Right.
minimize everything. Okay, yeah, I've got it. Now I just hit. Well, my PowerPoint is open, but it's not on. I'm not in the Zoom thing.
Yeah, no, share. You have to share that now.
Well, yeah, but I go to the bottom where it usually has share screen and it's not there. So I
Oh,
got to
no.
go to
So
Zoom.
do not do the complete open PowerPoint. So go back to, like, instead of sharing the PowerPoint or do the, instead of doing the slideshow, don't do the slideshow. Otherwise, you will not see the button.
Yeah, that's
So,
that's what happened. But Dr. Tano, I'm hearing everybody, but I'm not really, it doesn't seem like I'm on Zoom.
well, you are. We see you.
Oh, you see me?
Yeah.
We all see.
Okay, but I don't see it. There's not, like, there always is a share screen, except I don't have that now. It's always there except now.
It should be there. So
Maybe I should hit.
close the PowerPoint slideshow, so then you
Okay,
can
I
see.
minimized it.
Yeah. If you minimize it, it will not work. Just close out the slideshow.
Okay, hold on. Let me close it. Okay, I closed it. And then the thing about return
Yeah,
to
now
meeting
do the
popped up.
share, and click on the PowerPoint.
Okay, it's not there. So I have to return to meeting first. And see, I'm sorry, because when I hit share,
Yeah, okay, now you're coming in. You're
yeah,
coming
but it
in.
doesn't have my PowerPoint though.
Hold on, yeah, you have to click on your PowerPoint now somewhere.
We got your whole screen right now. We got
Yeah,
everything.
so click on your PowerPoint now.
Okay, I got to open it.
Yes, open it now. There you go.
Great.
And now go to the show
Okay.
slides.
There it is.
Okay. Yeah, isn't that great? But I don't, you can see it?
Yeah, you can see it. So go to the slideshow now on
Okay.
top.
And then from
show
beginning?
from the beginning, right? There you go.
Okay.
You
And
got it.
Now,
Okay,
now you
but you
can
notice, I'm sorry, go ahead.
now you can click the arrow. I mean, use your mouse and go or hit return. See if it goes down.
At the bottom.
Yeah.
So, Bob, if you're still having at the bottom there, you see it there.
Yeah.
On their education.
Yes.
You should be
There
able.
you go.
There you go. Should be able to advance it from there.
There you go. Now we can see the now it's working now.
Got
Can
it.
you see that muscle centric
Yes.
health?
Yep.
Yes.
Okay.
I have
That's me on a
I have
bad
your
day.
slideshow also. If you have trouble, I can put it up and sort of just.
Okay. Well, let's give it I appreciate that. Let's just give it a go and see what happens here, shall we?
Okay.
Yep.
Take it away.
Okay. All right. So here's the agenda. You can see this, right? I'll probably ask you 10 times. Can you see that? Okay. So here's the agenda, right? The introduction, what is muscle, neuromuscular system, the importance, physiology, metabolic importance, actionable steps, which that's the main thing with this. And first of all, let me back up by saying I really appreciate this. Thank you to Dr. Clearfield and your group. I'm so appreciative of you allowing me the time to do this. It's kind of funny. We tend to try to give things that we are quote unquote experts in, know a lot about, or learned a lot about, maybe back in school or whatever. And I don't know that anybody learned anything about this type of thing and the stuff that I'm going to talk about, because it's extremely, extremely critical. And as someone said, once we get done with this, when you see the value of muscle, if they say if big pharma could get all of this stuff into a pill, it'd be the greatest selling drug in history. But that is the easy way, looking for the pills and things. And even as Dr. Nerio pointed out, there's some things that we're coming up with, like the ARBs and all of that do a little bit of the metabolic benefits that we have here. But this is a lecture that hopefully will stimulate people to do things about it, because a lot of us are just not where we should be and can get so much healthier and kick off our foray into longevity through this. So I'm really kind of excited to get onto the actionable steps and all of that kind of stuff, right? And then we'll talk very little about diet. Okay, diet is what I call a minefield topic. Every time you talk about one thing or another, there's people that say, no, that doesn't work, or you got to do this, or you got to do that. But the basic thing for muscles is protein. And then the part that I'm excited about is talking about resistance training to build muscle. And there are resistance training has to do with the body, right? Bands, isometrics, and weights. And then there's a recovery, sleep, and then VO2 max cardiovascular function. And then there's a little test here that I can't really wait to have you guys take a look at. Okay. And again, like I told you at the beginning, Dr. Clearfield, this is my goal for the whole thing right there. Lift heavy items. Okay. And it shows like the lady, you know, can you do this? Lift bags of groceries and carry them. Can you move? Right. There's a couple of things there. Lower left, somebody, can you pick up a child? Can you bend and pick up things from the floor? And only Stefan can lift that weight with one finger, I think. So we'll leave it at that. And then 70% of Americans are overweight. And I think I'm hearing 40 more percent of Americans are actually considered obese. Right. And then this quote here, we're not over fat, we're under muscle. That's attributable to Dr. Gabrielle Lyon from her book, Forever Strong. I'm going to do a bunch of references in this that might be a little bit different to what people are used to. I consider this type of forum, webinars and things, a lot like podcasts, only not live, right? So what I'm imparting here and what we all do through these webinars is our study, our research of articles or what have you, and then we present that type of thing. And which is kind of the way we did in school, right? We relied on our professors to do the research, know the research, and give us the skinny, give us the information. And that's what this is. And I encourage people through this, if you have desire, because we all have need, to get on some of these podcasts and learn. Some of these podcasts are very technical, and they throw up references and all this kind of stuff, right? It's a phenomenal way to learn. And as they used to say, something like it takes 15 years to get from the bench to the bedside. And that's when we all had to, wait for the latest issue of JAMA or New England Journal or Lancet or something to find out all the information and then maybe try to put it in practice. Now the stuff is instantaneous. Okay, so that's why I will cite people like Dr. Gabrielle Lyon. She's a DO. I've tried to reach out to her, Dr. Clearfield, to get her to come on here, but I don't get a response. So it's one of those things where they're so doggone busy. Anyway, moving on, muscle is the organ of longevity, and it's governed by the brain-muscle connection. Muscles don't do anything by themselves. An interesting fact here is in evolution, the main reason that we as humans have a large brain is so that we can move. Our movements are different than any other animals. You can't teach any animal to do a triathlon. You can't teach them to do a biathlon. They can't shoot and then ski. They can't do gymnastics. Very rare that you can find an animal that can swim and run. Okay, humans can do it all, and that's why our brain, comparative to our size and others, is absolutely huge, and it governs the different types of and duration of movement. The thing here about lifting increasingly heavier objects, you can increase speed, smoothness of movement, and create new movements by doing this. And of course, muscle is important for metabolism. The one thing I think is extremely critical is the more muscle you have, the healthier you are. And something that we don't think about is that when you have more muscle, you have tremendous skin health. Your skin looks better. And there's a lot of theories about this. So you can measure this and say, oh, these people have muscle, the skin looks like this. But why is that? It's because they talk about developing muscle sends out signals all over the body to increase our our growth in certain areas, and skin is one of them. And of course, it's linked to posture and aesthetics, and muscle can be lean or fatty, which is another important point. You either have a ribeye steak in your muscle where fat gets deposited there that's not useful, or you have a prime cut that is mostly muscle. Okay. And then here's skeletal muscle as an endocrine order. And you're going to see slides like this throughout. This comes from circulation. I think this is one of the ones that I might have picked up from Dr. Miletus that he showed, because it does give you a whole lot of information on how the muscle secretes myokines to do certain things. My favorite one is, besides BDNF, is
Yeah. Sorry,
We
everybody.
lost him.
Yeah, that was. Go ahead, Bob. Sorry.
Am I okay?
You're
on?
on. You're on. That was.
Okay, yeah, because
that
it said I was muted. Okay, you want me to shut it? Okay, I get it.
No. It was I tried to click somebody in, and one of my co-hosts did it, and you got.
Oh, okay. Muscles, organ of longevity, plain and simple, right? And it's a proxy for total health, right? And then life skills improve, and we need to lift as we age. And I'm going to go over this a lot. That you start where you are today, start tomorrow. Doesn't matter what you lift, how much you lift, or what you do. And we don't talk about products, we don't talk about companies, but I will tell you this, is that our group, we can help people who have as little as 5 to 6 minutes a day start improving their overall health. And the main thing that we have to keep in mind when you talk to your patients or yourself or your spouse or your neighbor, right? If they want to do anything, we all need to. You don't say, okay, all you got to do is train 30 minutes. That's all the stuff comes out. 150 minutes of brisk walking a week, and this is going to do this and that. That's the wrong approach. The right approach to move people is to find out how much time they have. And I mean, if you've got 2 minutes and you brush your teeth, we can come up with something that you can do that's going to help your muscles. Also, skeletal muscle is an endocrine organ. It's probably 40% of the body mass. And it's a nutrient sensing organ. It's sensitive to the quality of our diet and amino acids, of course. That's the big thing. And amino acid reservoirs for protein turnover. You're going to hear me talk a lot about leucine, one of the essential amino acids. The standard that we're seeing in all the literature now is you need about 2.5 grams per meal if you eat three meals a day, and you're 2.5 grams of leucine in your meal, and your total protein needs to be anywhere from 30 to 50 grams each time. Okay, and then again, glucose disposal. So when you eat and your body's got glucose, where does it go? Well, we don't want it to go to fat, but 80% of it heads to the muscles. And if you don't have the muscle mass, it's not going to stay there, and it's going to go back into circulation, and it's going to go to visceral fat or where else we don't want it. And then body armor is pretty important because, we talk about falls and all that kind of stuff. And if you have no muscle, you're going to break. It's just pretty doggone simple. And I like this thing where it's responsible for how we age. If we don't have muscle, we're going to age much more rapidly and not very well. And then, of course, common diseases that are involved, and we'll cover this later, cardiovascular, diabetes, et cetera, that begins in skeletal muscle. So you don't have diabetes and then your muscle starts to deteriorate. It's the other way around. And then skeletal muscle, of course, burns fatty acids. When you're not exercising, right, your muscles don't burn much glucose. They burn the free fatty acids that are there, and stores of glucose as glycogen, and that's where it's burned. And then the one of the big issues is, and I don't know we'll ever be able to figure this out, we don't know the optimal amount of muscle for each individual person, and of course that varies, and a lot of it has to do, I think, with genetics as well. And I'll talk a little bit about what the two aspects of genetics are that are real obvious that we can't really do too much about. And this is the neuromuscular system and the junctions you can see there on the little graphic. The thing on the right, hopefully you can see that. I put that in here to illustrate the fact that we have, there's a technical term, but it's like a lockout system. So if you are lifting your bicep, if you're lifting your hand up to your chin or hand up to scratch your ear, your bicep is engaged, but your body totally locks out the tricep. It will not work when you're going one way. And when you put your hand down, your tricep or the back of your arm pulls it down and your bicep is totally locked out. Otherwise, you'd be fighting. You wouldn't be able to lift your arm and put it back down smoothly, right? So it's a really nice system, and it's based on the neuromuscular junction that we have. There's 3 components of the neurons. There's the upper motor neurons, the lower motor neurons, and then the central pattern generators. And you can see here kind of what they do. The upper motor neurons are deliberate movement. So that's can you pick up and throw a ball? That's the upper motor neurons in the brain motor cortex. The lower motor neurons cause contraction via acetylcholine, and the central pattern generators are rhythmic movement. So you're walking, and most of us don't say to ourselves left, right, left, right, left, right. You're just walking, and your central pattern generators are what picks that up and takes over, and it just allows you to do that without thinking about it. We use the nervous system for muscle growth, and there's a term I hope you guys are familiar with. If not, we're going to talk a lot about it, and that's hypertrophy. That's kind of a critical component here of this. Now, the neuromuscular connection, muscle metabolism is how muscles create and use energy. And there's something else that I'm going to really get into here, and that is called the 1 rep max. And in case yes.
This is Dr. Patel.
Hi.
Can you please go over what happens in upper motor neuron disease or ALS, the previous slide, and can you discuss a little more? Because we want to find out how to increase the muscle mass in ALS, because their muscle wasting is the big problem when they are losing. I'm sorry I had to disturb you, but if we...
No, that's fine. I will tell you that I am certainly no expert in how we treat ALS. However, you're 100% correct. That's one of the diseases that is so debilitating due to what happens with the muscle. If there's anything that can be done, and from what I see, what I read, what I hear, is that at the very beginning or the onset, when people know this, now we have to dedicate all our efforts toward that, which means make sure the protein intake is right. And as you know as well as I do, there are things that we don't control real well as far as toxins and things like that are going to affect us. But if we can maximize the protein intake in people like that at the very beginning, we have a better shot at slowing it down. I'm not going to say that I ever saw anything that says we can reverse it, but I think we can slow it down. So, and I have seen cases of people in the literature who have ALS, who have begun doing things to increase muscle. And I'm not going to say hypertrophy. I'm not going to say build muscle, go out and lift weights. It's using them, right? And that goes into anabolic resistance, which is a big thing with ALS. It's anabolic resistance. What that's saying is that if you have ALS, that you can't build muscle. Well, the main thing with that is please learn movement. Learn deliberate movement from the upper motor cortex before it deteriorates so much to where you cannot control the movement. And that's where the upper motor cortex comes in on that. Hopefully that makes sense.
And what about Ensure? The Ensure high protein, it actually is prescribed at the VA, and it's 60 grams of protein in a little drink, and you can do a couple drinks. Actually, when you're in the hospital, if you notice, they give you an Ensure.
Yeah, they give you Boost, Ensure, those kind of things.
Yes, exactly.
Okay.
And last time I argued with a doctor, I was like, man, did you see how much sugar is in that? And she's like, oh, you mean like what you're drinking alcohol?
Yeah.
So
Joel, that's such a great point. That's the killer, is the sugar. But we have to consider something. when you take in protein like that, what they don't tell you is maybe 10 to 20% of that is absorbed. So if it says 6 grams, 12 grams, 15 grams, you're not absorbing 100% of that. And that's why it's very difficult to build muscle with protein things like that. And then it's got the double whammy of the sugar. So if you can do protein shakes or drinks on your own, that's a little bit better, because some of the stuff you can get as much as 50+% absorption into the body. That's the key, right? It's not what you take in, it's what you absorb.
And you absorb what you exercise.
Well, yeah, and think about this too. Any type of protein that you take in, remember, the protein that you take in doesn't go to your muscles, right? The protein you take in is broken down into amino acids. So it's not the protein, it's the amino acids. And our body combines these amino acids for human use. So if you eat a steak or something like that, that's cattle protein. That's different.
Right.
So we got to break it down and recombine it. And we can't talk about this, but there's companies out there, and one of the guys we all know has got products that combine the right amount of amino acids. And then, like you said, then you do exercise and you're on your way. But I would never suggest anybody just right off the street try to live on a Boost or Ensure or any of those kind of things. Hospital, yeah, you got to. You know, we all know you got to do what you got to do to get a little bit well there. But what I don't like is the sugar. I mean that's worse.
It's horrible.
No, exactly. So
isn't that amino acids have to bind to minerals in order to be utilized, and so it makes a mineral complex. And if you don't supply the minerals with the amino acids, then it's not being utilized. You think you are taking it, but not really being. Yeah.
You're right, and I liken it back to, remember our old days in hospitals when we had hyperalimentation, right? We had the amino acids, the fats, and the electrolytes and all that stuff all put into one, right? So people that are in that state, you know, they're expensive, but rather than have Boost, it would be better if they had hyperals. Okay, let me talk about real fast about the and thank you for jumping in here, because that makes it much better. And I think the questions and the statements that people ask are germane to what people want to know, and that's what this is all about, right? Understanding and knowing what's going on, and then knowing how we can move the needle, as they say. So I want to talk about this thing called 1 rep max, and I don't want to get too deeply into this, and it's here throughout. And what that means is, if you take something real simple, and I think excuse me, most people know what curls are. If you don't know what a curl is, you're standing up, you have your hands, your arms to your sides, your palms facing forward, and you lift your palm up towards your shoulder. Okay, that's a curl. Now, we talked about that as far as bicep innervation and tricep deregulation, if you will. Okay, so what you do in this case is you have a weight that you can basically do 1 rep without losing your form, right? Because we can all like bend back, use our waist, and throw our arm up, and that's more weight than you should really do. I mean, you can tweak yourself and all that, but 1 rep max is maintaining form, and it's kind of like the most weight that you can do. Now, with a 1 rep max, when we can change the size of the muscles, and that's hypertrophy, or we can increase or improve strength or endurance. So if you take a 1 rep max, you take 30 to 80% of that. If you do a higher amount of your 1 rep max, let's say over 50%, 50 to 80%, and we're talking curls, and it works for other muscles too, but the curls is the best example because people understand that. And you do 50 to 80% of that weight, you do minimum amount of reps, maybe 5, and that builds strength. If you take the lower end, 30 to 50% of that, you can whip that up a lot. You can go 10 to 15, 20 reps of that. Doing that type of exercise builds hypertrophy, which is the muscle growth, which is what looks better. I may have in here somewhere, but since we're on it, I want to talk about the fact that we've all seen Mr. Universe, Mr. America, and all that. Okay, that's hypertrophy to the max. Now, those people are strong. Don't get me wrong about that. However, they're not the strong men out there. If you've ever seen a strongman competition, nobody that looks like Mr. Universe is lifting. They've all their muscle strength is the main thing, but muscle strength doesn't lead to hypertrophy. So if you're in the gym and you want to look good, right, you take a lower amount of weight and do a lot of reps. If you want to build that strength, then you take a higher percentage of your 1 rep max and you lift that. The best thing to do as we age, we're not in high school here, the best thing that we do is a combination of both. And I will go into a little bit on how that feeds into testosterone and that type of thing as well, okay? And I'm off topic here. Glycolysis, how muscles utilize energy, and muscles are the most expensive. They are metabolically demanding, right? It is the most metabolically demanding system we have. Some people will argue that it's the brain, and that could be true, and especially in people who don't use their muscles, it's the brain. The glycolysis, or the glucose, breaks down into pyruvate, and that generates 2 units of ATP. When you combine pyruvate with oxygen, now you're really using the ATP within the mitochondria, and that is maximum amount of health right there. And people, this is kind of funny, people with more muscle can eat more, and they actually have to maintain that muscle, right? You can't starve and build muscle. This is something that we've all heard about: lactic acid. Throw that out. All right, it's lactate itself. So when there's insufficient oxygen, pyruvate turns into lactate, and that's what causes the burn. It's the lack of oxygen in the muscle, right? So this is a nice pearl here. 10% of the time you should exercise to the point of feeling the lactate burn, because that's what increases the muscle size. 10% of the time. And what does lactate do? It's a buffer against acidity, and it's a fuel. So if you are lifting something and you start to feel the burn, the lactate says you can do a little bit more. It allows you to. Now, this is important not only in the gym, but this is important if you've got to carry something and it's critical and you got to move it from point A to point B and it's heavy and it burns, you don't drop it. The lactate allows you to continue on a little bit more, right? Which I think is just extremely important. And then, of course, it at the site of the burn, it acts as a hormone. And this is kind of interesting. Lactate sends positive signals to your heart, your liver, and your brain. Now, what is that all about? Well, to your heart, because you're going to want to pump more oxygen when your lactate is kicked in. It's very strong. Your liver, okay, so you've got glycogen storage there. You're going to need that to help move. And then your brain, right? You're going to stimulate the brain to continue on, to tell yourself stop, go, whatever you need to do. So it's extremely important to understand what lactate does. And you're not, when you lift or you move things or something, or you're walking carrying something heavy, it's not lactic acid and you're trying to get rid of the lactic acid. That's a misnomer. Okay. The neuromuscular connection, we'll go quickly through this because I've talked about some of this, but the people that when you keep in mind that your muscles can get bigger and they always get stronger, but strength doesn't mean bigger muscles. That we talked about that. So it's nerve isolation versus nerve distribution. And here we do want muscles to get stronger as we age because we don't want sarcopenia. Okay, and then plus it messes up your posture. We've all seen older people that are hunched over that have, horrible posture or whatever. That's lack of muscle if it's not a skeletal abnormality. We're not talking about certain abnormalities. We can all point out exceptions to these things, but in general, that comes from years of not doing enough exercise in the correct position. And again, I'm not talking about a pathological condition here. The other thing that I think is extremely interesting here as far as neuromuscular connection is, and that's the Henneman size principle. And very simply, what this means is you have a glass of water sitting there, and your brain tells your muscles how much to use. You don't pick up that glass and throw the water in your face because you lift it really quickly. Your brain says, don't do that. You only use a certain amount of motor neurons that are necessary for the action that you are doing. And we've all seen things where you go to pick up something and your brain tells you, oh, it should be this heavy, and you go to lift it and you go, whoa, oh God, no, it's heavier. And then you got to kind of reset and go, okay, I need to muscle up a little bit on this. Well, that's the Henneman size principle, and it's a conservation of energy. You don't overuse energy when you're lifting things, and that's normal usage. We're not talking again about weightlifting or something like that. And then there's the three major stimuli that dictate how muscles can change. That's stress, tension, and damage. In red, the two most critical issues we're talking about here are how best to train and how best to eat. Those, as I say, are minefield topics. You get in with a group of people, and no two people, 10 people, no two people are going to agree on how to eat and how to train. They're all different. Now, this myosin actin filaments, the balloon theory, is something like you're holding a handful of balloons, but they're not all at the same length. You got the strings and you have different lengths, and that's kind of like your myosin. And then the actin is like the balloons, and then by activating the muscles, the balloons can get bigger, and that's how your muscles grow. And this is, I'm citing down here at the bottom, I don't know if you people have heard of Dr. Andrew Huberman. I'm going to talk about that a little bit. He's professor of neuroscience and ophthalmology at Stanford. And they do all this research in this, and he's kind of the pioneer in this neuromuscular type of stuff. That leads us to myokines. And I will say that Dr. Miletus, and then I think also, well, Dr. Clearfield to some degree talked a little bit about this. So we're not going to go too deeply into this, but this PowerPoint thing is available. If anybody wants any of these slides, I can singularly send them, or you can look at it and you can come back through, but I'm going to pull a Dr. Halasa here and buzz through a lot of this stuff pretty quickly. Okay, and myokines are proteins, and they play a very critical role in all kinds of physiological processes, including metabolism, inflammation, and even brain function, which we'll get on there. Myokines are secreted by muscle cells and myocytes in response to muscle contractions. Now, people that don't do any, and when I say exercise or I say lifting, please don't picture being in a gym. Please picture daily life, because that's what we're talking about. Can you get on an airplane and lift, your carry-on over your head and put it in the overhead compartment? Okay, this is daily life stuff. Some people can't do that, right? And so that needs to improve. And the myokines basically are signaling molecules, and they influence other cells and organs through different mechanisms. Now think about this. They have autocrine effects, which they act on the cells that actually produce the myokines, then the paracrine effects, which is other cells in the muscle, and then the endocrine effects, they release chemicals that have effect on distant tissues and organs through the bloodstream. So you begin to see, how important this is. And I lost my cursor. Okay, I think I lost my cursor. What does that mean, Dr. Clearfield, when I can't find my cursor? Let's see what happens. Okay, I guess it's there. All right, here's myokine release. This is a slide that I've seen before. I think many people have seen before. And again, there's only two things I want to point out here. Well, 3, BDNF is critical as well. Interleukin 6 is a double-edged sword. Irisin, you can see increases muscle mass, hypertrophy, and fatty acid oxidation. The one that's a little bit different is myostatin. That increases atrophy and decreases muscle mass. Now, why do we have that? Well, all of this stuff that I'm talking about really is based on balance, total balance. If you didn't have that, If every time you took a drink and you lifted your your drink up to your mouth, you're going to start building muscle. And can you imagine what that would be like if you basically never stopped? And that's kind of, this is kind of a buffer system on that. So in the next few slides, we'll talk about here at the bottom, like improving metabolism, reducing inflammation, cardiovascular health, stronger bones, better brain function, and even cancer protection. Regular resistance and aerobic training maximize these effects, and that supports the long-term health and longevity, which is what we're looking for. So the first one.
Doc, real quick.
Yes, sir. Yes.
This is why a lot of the senior citizens that you see are walking every day are doing okay and doing better, because just like you said, they're not going to a gym, but they're just exercising. Right. They're just walking. They're just moving.
Yes. And remember, now that's the third triad of what the muscles do. And as Dr. Patel said, if we talk about the upper motor neurons, we need to combine that, because walking does a lot of things. Right. Phenomenal things for longevity, but we need to include the upper motor neuron system to make sure to, let's say, stave off things like ALS.
So right? would that mean walking with carrying like yes, 0.5 or 5 pound weights?
You got it. And every now and then curl it, lift it over your head. 100%, right. Joel. Right. That's a great example. That's 100% is what should be done. And I'll digress here to also tell you there's something called the farmer's carry, right. Which is, I don't know if you've heard of this, right? You grab heavier weights or heavier objects, bags of groceries with bricks in a bag, whatever you can do, and just walk with it. And it is phenomenal for your health. Phenomenal.
Got you.
Okay. So metabolic effects, enhanced insulin sensitivity, and how many lectures have we had about that, where insulin sensitivity is one of the keys. And here's our buddy Irison again, because he's improved glucose uptake. We'll get into a couple of slides here on the GLUT4 translocation, not a lot, but it reduces.
Dr. Quinn, can I interrupt you 1 minute? We as a physicians in the office, what can we do intermittently that we don't have, at least I'm not an Iron Man or Iron Woman, but right. What can we do so that we can be more fit? And
yes.
Just like you mentioned that, put that bag in the plane, I can never do it. So
we got to talk.
Yeah.
Okay. No, and forgive me, I'm so glad you said that, because I had that as part of my introduction and I skipped it. And that is those people who went to school back in the day where your value, part of your value was based on abusing yourself, not having sleep, eating on the go, going to the nurse's station, getting some donuts or whatever. It really caused people to go downhill rapidly. So, as you say, we have to do something very simply to start. And I have things that we can do to start that we can talk about, but in the office, between patients, if you can do a squat or 2 or 10, do it. If you can do half a squat, do it. If you can, and this is critical. And I'll go back to Dr. Clearfield, to your lecture. I re-listened to your lecture, and the question was asked about that thing about tensing muscles and then letting go. Tensing muscles and letting go. What that is basically isometrics. And at any time in the office, you can do things like that. Hopefully you can see me, but you can clasp your hands like this, and for 3 to 6 seconds, pull as hard as you can. You don't have to pull extremely, as hard as you can. Okay, do that. That's an isometric hold, and that stimulates muscles like crazy. So in between patients, do that a couple of times for a minute. You can push your hands together as hard as you can possibly do. And I'm telling you, they're talking about do it for 6 seconds and do it 3 times. This takes no time. Squats, if you can't do a squat, then bend your knees, maybe lean against the wall for 10 to 30 seconds. You can do all of this in the office and you're not taking up time. One thing I always suggest to people that, from our, field where, we don't do what we should, but I'm telling you, your patients are looking at you. You know this. And if you look healthy, they're more apt to follow you. They understand your knowledge and your ability to communicate health things to them, but they're looking at you. And when you start to look better, your skin looks better, your energy is better, you are healthier, they're looking at it and they're seeing it. When you brush your teeth, do a squat or 2 or 5, whatever you can do. You brush your teeth a couple times a day, do it. And you will eventually get stronger and get all the benefits here, right? It is not time consuming. And that's why I said in the beginning, you ask your patients and yourself, oh God, I am so busy. Single mom, got the kids, got all this kind of stuff. How much time can you give? Can you give me 3 minutes a day, right? 2 minutes a day, and we can come up with something that can start you on your way. And I hope, Dr. Patel, I hope that answers you.
Thank you.
Sure. Okay, so GLUT4, we'll talk a little bit about that translocation. There's really an interesting topic with GLUT4, really interesting. And then, of course, fat metabolism. And there's my buddy Irison again, stimulates conversion of white fat to brown fat. You know what else does that? Cold showers. You get, and I say cold showers because not everybody's got the time, the energy, or the will to get a cold plunge. Now, maybe Hartman does, but you don't have to have an ice plunge to do this. When you get done with your shower at the very end, do as cold as you can stand it for a little bit. And it actually will stimulate the brown fat from the white fat. Brown fat, what's the difference? Brown fat and white fat. Brown fat is full of mitochondria. That's why it's brown. Okay. And then myonectin enhances the fatty acid uptake and improves lipid metabolism. And then the anti-inflammatory and immune benefits. Haven't we all figured out that inflammation is kind of like one of the hallmarks of many of the diseases and many of the problems that we have, right? Inflammation. Well, okay, we can reduce chronic inflammation. And remember, we're talking about myokine release from skeletal muscle by using them, not sitting around, right? So IL-6, exercise-induced, has anti-inflammatory effects. And it lowers the risk of chronic diseases like cardiovascular, obesity, and all of that, arthritis. Also, immune system modulation. Myokines help mobilize immune cells. And then also, one of the best things here is going to be the, I'm sorry, I'm trying to find my cursor. The anti-tumor, it promotes anti-tumor environment. And this is another one of those things that I talk about a minefield topic, because now somewhere we're going to get into a little bit into mTOR. Cardiovascular benefit. Well, we know this. We inherently know this. Exercising or moving around improves heart function. We know that, improves circulation. And as I always used to tell people, I don't care what supplements you take. If you have poor circulation, you're not getting the maximum benefit. You've got to have circulation. You've got to get this stuff to all the tissues. And that's where the exercise helps do that. And then, of course, reduced risk of atherosclerosis. And here's our buddy Irison again. And then by circulation, we know helps prevent the plaque buildup. Now, if we combine this, and Dr. Patel, you know this so well, if we combine this type of thing, improving the circulation with detoxing, I believe it's the mercury that helps hold plaque together in the arteries. If we decrease the mercury and increase the circulation, we have really, really got a leg up on athero. Bone health, that's the Irison again, and I didn't even put it in the slide. Muscle growth, muscle and bone health. There it is, I'm sorry. Under the bone strength and density, Irison does that, promotes osteoblasts, okay, and a reduced risk of osteoporosis. How many people do we know and we always think about the ladies, right, of osteoporosis. We don't think about the fact that A, men have this problem, and B, sedentary young adults have this problem as well. You're losing not only muscle mass, you're losing bone density. And that is a fast ticket to sarcopenia, which is aging. And then brain health, my favorite is BDNF. I will tell you from personal experience. Now, I don't know if there's anybody out here that are runners and they talk about the runner's high, but I will tell you, not every time, but after a workout, a weight training, a resistant training thing for myself, my mood really picks up. But that's not the only thing. It improves the BDNF, improves neuroplasticity, memory, and learning. Remember this, neuroplasticity, okay? Memory and learning, strengthening the neural connections. We do not grow more neurons. As a matter of fact, the human brain has been shown to kind of resist having too many more neurons because the human brain doesn't exactly know what to do with them. It's overload. So what we want to do is strengthen what we have. And then, as I mentioned here earlier, the mood enhancement, linked to increased dopamine and serotonin. The dopamine release comes from thinking, you know, I do need to exercise a little bit because I feel better. Okay, that releases the dopamine that tells you, ooh, I'm doing a good thing. And then myokines and brain function. And then, of course, you know, BDNF, which we just talked about. The other thing is physical exercise has been shown to elevate cerebral levels of VEGF, vascular endothelial growth factor, and it promotes angiogenesis in the brain, okay, and enhancing blood supply and potentially supporting neuroplasticity. Okay, why do we want angiogenesis in the brain? Well, obviously, I mean, that's how we're going to get our nutrients and everything to the brain, which we need for our cognitive health. That is pretty critical. For those of you who are thinking about, and it's always in the back of my mind, people thinking about cancer. Okay, we don't like angiogenesis and tumors and all that kind of stuff. We're going to see that not all things that we do to stimulate mTOR and things like that directly go to cancer cells. And as Dr. Clearfield's lecture pointed out, we've got mTOR complex 1, mTOR complex 2, which do different things. And next week somebody's gonna discover mTOR complex, you know, C3. You know, it just goes on and on to the value. And then, you know, PubMed type of thing. I put this in here for people who like to see this and like to read the abstract. That's there. You'll see a few of these in here, but I'm going to tell you that I hang my hat a lot on some of the information I get from podcasts. Here's our mind field, cancer prevention and anti-tumor effects, myokine suppressed tumor growth. Okay, and the secreted protein, the acidic, okay, the spark is also involved in this, and then our buddy irisin. Some reference journals, in case you want to click on these kind of things. It tells you kind of more specifically areas that I've talked about. GLUT4, you know, for time's sake, we're not going to go too much into this or too much into mTOR, but I do want to tell you that GLUT4 is an amazing type of thing. When you are exercising your muscles, and we don't need to go into all of this kind of stuff, but I will tell you, when you're exercising your muscles, GLUT4 in the transport system is in vesicles that are transported to the cells, which help the insulin go into the cells. And then they recycle. Then they leave the cell membrane or cell surface and go back into storage vesicles. But not all of it does. You have some GLUT4 that stays on the surface of the cells. And that's why when you exercise, you can drive some of the insulin into the muscle cells that it's needed for growth. You don't have to eat or carbo load before you exercise in order to do that, because you already have the transport system there, and it's going to pull the insulin that you have. So as Dr. Joseph says, let's think about that. Okay, so now we have problems with too much insulin in the body. Well, by exercising, the insulin that's there already is going to be transported into the cells. We don't need to have more. So now we're lowering the floating insulin, right? So that is basically helping our overall health and decreasing insulin resistance. So again, using our muscles is going to be key to stopping insulin resistance in kind of I want to say a roundabout way. Okay. And GLUT4 again stays there independent of insulin. It's going to stay there. Insulin is not the only thing that causes that transport, shall we say. And then here's this little article again in these two purple highlights. And if you look at the second one down there, and I'll read it. While acute regulation of muscle glucose uptake relies on GLUT4 translocation, glucose uptake also depends upon muscle GLUT4 expression, which is increased following exercise. And that's just what we were talking about. Protein. Okay. Roughly 60% of the body's water. Half of the remaining 40% is protein. And I was not a math major, but that I think works out to about 20%. And then proteins are the master regulator of all that's happening in the body. I mean, everything. Everything is proteins. Okay, balances the hormones, supports energy production, cell-to-cell communication, antibodies, this type of protein. And we all know hormones are insulin and things like that. Thyroid hormones are made from amino acids. And they regulate blood glucose. We all know this kind of thing, bone health and all of that, metabolic rate. Okay. And then, of course, the brain uses protein-rich foods to produce neurotransmitters. Another reason why we need adequate protein in our diet. If we don't get the adequate protein, we're losing out on all of this stuff. And as I go through some of the benefits, then I'm going to hit things like sarcopenia, and it's going to show you the negative of all the benefits that we just talked about. And we won't go too deeply into this. Leucine is the big boy. Okay, a branched chain amino acid, and it's a critical role in stimulating mechanistic target of rapamycin. I think in here sometimes I call it mammalian target of rapamycin because the originator, as Dr. Clearfield was talking about, that scientist that found it on Easter Island, Rapa Nui, called it that, mammalian, and then they found out, well, maybe it's not only mammals. Okay, so where am I? Leucine activates the mTOR C1 in skeletal muscles, and it's a combination of nutrient sensing mechanism and, of course, crosstalk with insulin. All these things work together in balance. And our effect on skeletal muscle is muscle protein synthesis. That's where the protein are synthesized from the muscles. That's how we are, building other tissues in the body. Proteins are doing that. Whether you're repairing something, you have a cut, you have a broken bone or something, you got to have the proteins in there to heal. And then enhanced muscle hypertrophy and recovery after resistance. And I'm going to tell you right now that yes, genetics does come into this. We've all seen people that, you might have seen in high school or whatever, these genetic freaks that are just muscular people just because they are. Okay, that's wonderful. But we can all, kind of emulate or maybe get to that point through exercising. But two things that are really guided by genetics, as far as muscle goes, are fatigue and recovery. You can fatigue out, and that is a genetic type of thing. Yes, you can kind of overcome some of that, but we've all seen people who, oh man, you fatigue, God, you get winded easily. That can be genetic, as well as a lack of training, of course. And then recovery. Recovery time is genetically mediated. It also is based on rest and nutrients and all that kind of stuff, but genetics guides the recovery from the get-go. And then protein and skeletal muscle. We're not going to get too much into this. This is where we get into the weeds with the leucine uptake and kind of hit the mTOR pathway and all that kind of stuff, right? But leucine uptake is extremely critical. And there's a whole bunch of the GTPase complex and all of this kind of stuff is a switch to activate mTOR C1, mTOR complex 1. mTOR complex 1 and complex 2 do slightly different things. And when you're targeting these for therapeutic activity, as in cancer, then you're not always targeting every mTOR system in the body. There's no way you want to suppress every mTOR system in the body. We can talk about people that say longevity and aging. Oh yeah, give rapamycin so you can inhibit mTOR. Well, that can be a useful tool, but as Dr. Clearfield's lecture pointed out, I believe it was his, where it says, the autophagy and cell cycling can be based on your sleep-wake cycle and when you eat. I think that, Dr. Clearfield, I think that was in your talk, and that's very critical. We don't always want to suppress mTOR. I will tell you this. No serious bodybuilder, and these are people, and I'm not talking about exercise guys, I'm talking about serious bodybuilders, will ever take rapamycin. They just won't do it. And I lost my cursor again. And then there at the bottom, okay, so we're talking about the insulin factor, and leucine and can enhance the signaling through the insulin pathway, and there's the science stuff on that. If people are interested, you can check that out. Here's our minefield topic of mTOR, okay? And it regulates, very simply, cell growth and metabolism. That's what we need. And it's a balance. You can't live without mTOR. You don't want too much. You don't want too little. You got to have a balance. And that's why we don't do anything 100% of the time. You don't sit there and exercise 100% of the time. You don't eat 27 meals a day. You balance it out. And hopefully people have the right leptin levels to where you stop eating. Okay. And so we do need the mTOR. We can't consider that a bad guy. Okay. Otherwise we wouldn't have it. And then down here, nutrient sensing. Okay. So that's the mTOR C1. Growth factor signaling, right? Growth factors and all this kind of stuff. This complex, it shows this REB, I guess we will call it, relation to energy status and AMPK regulation. And then when cellular energy is, the ATP levels are low, the AMPK, right? The kinase is activated. And then here's the mechanism that shows, how that works and how we actually can conserve energy. Remember, our body does a real nice job of conserving energy. And again, that's the Henneman size principle. We don't overuse energy. Our brain tells us to conserve energy when we need it. And of course, our brain knows we're going to sleep. We get tired, and we need some of that energy for autophagy and whatever else happens when we're sleeping. This is something that I really want to include here because I don't want people to think mTOR is one thing, does one thing, either good or bad. I'm not going to go into too much detail here for time's sake, but there are cellular differences that we have here. And mTOR C1 primarily controls cell growth, and C2 is cell survival. So there's a little bit of different thing here. We're going to want a little bit of both of this kind of inhibition and cancer type of situation, right? Because we don't want a lot of cell growth, and we don't want a lot of that type of cell survival. So mTOR is going to be prevalent in kind of our treatment of that, which means caloric restriction in cancer patients, right? Don't give them a bunch of insulin. Don't give them a bunch of sugar. I mean, that's pretty obvious here. Okay, moving on, next slide here. Same thing differently in different cells. Endothelial cells, cell survival, okay? And this is important for microvascular repair and angiogenesis. We need angiogenesis in our body, as you know, because first of all, anytime you are increasing your muscle, you've got to have blood going there for oxygen and nutrients. So mTOR is what helps with that. So obviously, you're not going to want to inhibit mTOR to the max and then think you're going to get stronger or be able to do more. Can you lift your grandchild out of the crib? Can you do that? Can you bend over and pick up your grandchild? Okay. You need mTOR to feed your muscles so you can do this. And then cancer cells, as we talked about right there. And there's something about, I'm not an expert on this quiescent cells, where mTOR can actually turn off cells without killing them, so they can be used later on. And I think this is something that is pretty interesting, and maybe someday, you know, I'll try to get into that to see what we can do, especially in cancer, to turn off some of these growth cells. And then T cells, right? Regulatory T cells and all of this kind of stuff. mTOR signaling is crucial for differentiation and function. So again, mTOR acts differently in different cells. And this is a pretty good summary here. It's a conserved protein, but its activity and specific function has to do with the type of cell that is it's involved in, and the complexes and everything that are involved in that cell. Okay, they do different things. Metabolic effect of muscles. Gosh, for time's sake, we can go through this. I want to, and this is the fun part. This is where I really want to go. Okay, what we have here is resistance training, and this is the key to metabolic effects. Okay, there are a couple of different ways, three, right? Body or isometrics, bands, which you can use, and weights. And we'll talk just a little bit about that. And then I'm not going to read all this kind of stuff, but you can see here the things that we've kind of talked about and that I want to stress over and over and over, because as I said, you know, and Dr. Patel, thank you for bringing it back to the beginning. I want all practitioners to understand the value of this, how critical it is, and that there is need to do this. Imparting this information to your patients and yourself is going to help your overall health. And if you're prescribing any type of drugs or anything like that, okay, like you know, you talk about anything, statins or something, there are sites of action where you want these things to work. Statins are a bad example, I'm sorry, but there are sites of action you want these things to work. But you know, these things go all over your body. You know, like you were talking about the ARBs, Dr. Nario, they don't just go to the heart. They go all over the body, and the circulation kind of guides that kind of thing. So we need the metabolic benefits of the muscles to push all of this stuff. And it increases your basal metabolic rate. What is that? That is when you, let's say you're doing nothing, right? How much of energy are you utilizing to just feed your muscles? The example is swimmers. Michael Phelps, if you know who that is, that guy had an incredible basic metabolic rate. He could be doing nothing and he is burning through calories, right? So that is a critical thing, because otherwise, if you don't have a decent basal metabolic rate, you're leading to sarcopenia. Improved insulin sensitivity, we talked about, enhanced glucose uptake and storage, fat oxidation, lipid regulation, and regulation of inflammatory markers. We kind of touched a little bit on that. Support for mitochondrial function, yes. Amino acid reservoir. Okay, so now we're eating things and we're building amino acids. They don't all automatically go to where they're supposed to go within the next 12 seconds, right? There's a reservoir, and the muscles hold those amino acids there for when they're needed, for when you break your arm, right? You've got amino acids there that are just going to fly to try to help fix that. And if you don't have that, then it takes longer to heal. I mean, why do you think that athletes that get hurt, that break a finger, they come back, right? And they do that through training and through strength. Other people that don't do that can take forever to heal. And we know that in older people, right? Fall down, break a hip, whatever. You may not recover. Why? Because you don't have the muscle strength to recover. And there's hormone regulation we talked about. And I want to say one thing here, which I think is pretty important. And that's for those of you who actually want to get serious about exercising. There are limits. If you exercise approximately an hour or less, you're stimulating testosterone. If you are overdoing it, these people that are going, yeah, I spend 2 hours in the gym, or I do this for a couple of hours, hour and a half, your testosterone level starts to decrease because cortisol takes over, because your body says, you're stressing me out. You're not building me up. You're stressing me out. So there is such a thing as over exercising. Okay. And then improved aging and longevity and sarcopenia. That's sarcopenia. Atrophied muscle, it's lack of muscle and lack of muscle activity. It's not just decreased muscle mass, it's decreased muscle function as well. And here we go. After a certain age of 30, 40, whatever, everybody's different. We lose 3 to 5% of muscle mass per decade, and it's worse after age 60. But keep in mind, this is not a sad story completely. You can build this stuff back. You can stop this, and you can reverse the muscle aging process. There's a lot of things we can't reverse in aging, but you can reverse the muscle aging process at any age with any level of strength. And the worse you are, I hate to say it that way, but the worse you are, the faster and more you gain when you start. So in other words, if you don't do a lot of weight training, or you don't lift bags of grocery, you don't do any of that stuff, you start doing that, and your improvement level, your percent improvement is extremely high. The person who is extremely strong has got to really work to increase 1, 2, 5, 10%. It is difficult to do that, right? So this is the encouraging thing for your patients, right? It's never too late. Start now, start slow, right? Start low, go slow, that old adage. It works and it helps, and their outcomes will be amazingly improved just by doing this. And then, okay, so here's all the things that I told you. I told you the good things. Here's all the bad things that happens with sarcopenia. All right, so we're not going to go too blasting into this, and it goes on and on. Okay, even all the way down to Dr. Clearfield. Altered hormonal regulation, age-related hormone changes. And like I said, you start doing some exercise, you're going to change the testosterone level. So the next time you do a test on somebody who has decided that they're going to work a little bit on their muscles, you're going to see a change. Is it after a week? I don't know. 3 weeks, 6 weeks, everybody's different. 6 months. And it depends upon how much, how often that you're doing this type of thing. But you're going to change your hormone levels, and that's cortisol as well. That's insulin as well. It's not just testosterone and and estrogen and all that kind of stuff. And then another one, of course, gut microbiome dysbiosis. So again, the only thing I can think of is if we can get exercise in a pill, look at all the stuff that it does. And then, okay, a couple of reference articles: metabolic syndrome and sarcopenia, in case you want to see that. Inflammation, roles in aging and sarcopenia. Right, more inflammation. You wouldn't think so, but as we all know, some inflammation is good. The inflammation that you're going to get, the chronic inflammation from sitting around, is not so good. We know that. The fun part, resistance training. Okay, on the left-hand side, we've got an older gentleman who may be holding this pose. Okay, that right there is called yielding isometrics. He's letting the world and gravity affect his muscles. On the right with the bands, if you're stretching and you're holding that band out completely and you're not boinging back and forth, right? That's another form of isometrics. That's called overcoming isometrics. Overcoming isometrics is where you walk up to a wall and you try to push that wall down, right? Now what that does is that locks in your muscles, and muscle improvement in strength or ability to do anything else that we've talked about is guided by what we call time under tension, right? Flex your muscles. And so if you're doing these bands or you're walking up to a wall and you're pushing on that wall, you are locking in your connective tissue. Your ligaments aren't shearing. Your tendons aren't shearing. They're locked and they're not being forced to stretch. Your muscles are doing the work, and that's why isometrics are so great, and that's why cavemen used to roll boulders in front of the cave. Okay, that's kind of an isometric type of thing, right? Lower left is muscle training with weights, right? And in the center is the same type of thing. And on the right, that can be either one. They all can. I mean, if this gentleman in the center bottom just held those weights there, that's isometrics. Okay. Overcoming isometrics is pushing against the wall, turning around, putting your back against the wall, and squatting down and holding it, right? That's the other type of isometrics. That's yielding isometrics. You're letting the environment force your muscles. And resistance training is medicine. Okay. Notice this is in sports medicine in 2012. So this is not new stuff. It's just people like us don't focus on it enough. We're so focused on everything else having to do with health that we don't look at the overall health that strength or muscles provide us. And I'm telling you, no matter what you do for your patients, if you're increasing their ability to use their muscles, you're getting them better without giving them things. Resistance training and metabolic health. Okay, we've covered all of this kind of stuff, right? Resistance training may assist in prevention, type 2 diabetes, all of these kind of things, cardiovascular health, all of this kind of stuff. There's just some percentages here on the one on the right, you know, for kind of reference purposes. Hypertrophy, I'm going to go fast through here. Hypertrophy is growth. It's muscle growth and its introduction to skeletal muscle. Hypertrophy resistance training, okay, and that's muscle protein synthesis also. Remember, the key or the best way to get hypertrophic is a small amount of weight, a lot of reps. And again, you can lift anything at home. You can do anything. I remember in the olden days, we would sit up on a countertop, put weights in a bag, stick your feet through the handles, and just lift your legs up. Okay? That's the cheesy, cheap way to do it. But it works. It's just do it. I think we've all heard that. 3 mechanisms for muscle growth in response to resistance training, mechanical tension, all of this. Here's the mTORC1 pathway. Muscle damage and muscle stress. This is the way that you build muscles. We all have understood about, they say, oh, you got to tear muscles down to build them up. Well, that's micro tears in the muscle fibers. You're not tearing muscles. You're just kind of doing these little micro tears, which cause the growth to come back. So what is that? Hormesis, right? What doesn't kill you makes you stronger. So as you kind of lift, it's not killing you, but it is making you stronger. And then here's more resistance training, and there's training variables. Now, this is what I covered before because I wanted to make sure I got to it. And this is the slide that talks about the 1 rep max, right? Moderate to heavy loads. And remember, it's like 30 to 85% of your 1 rep max is where you decide. I threw in a picture of Dr. Nario there on the right for you. And what we have here is somebody who does both, looks strong, but is also hypertrophic. Remember, hypertrophy will increase strength, but strength doesn't always make you muscle bound. And believe me, I've had some clients who say, well, I don't want to go to the gym because I don't want to look like that. And I said, dude, you're 60 years old. You have any idea how many hours a day you need to spend in the gym for the next 25 years to look like that? That isn't just happening, right? It takes effort. And I like to say this, and I stole this from Dr. Lane Norton. I don't know if anybody have heard of him. You probably haven't. He says the magic is in the things that you refuse to do, right? So if you want muscle strength and you want muscle health, the magic comes from the work. And a lot of people refuse or dodge the work. Well, can I do it just once a week? Well, you can. You're going to get better, but you're not going to get the total benefit here that I'm hoping that everybody does. Okay, so it's important, as we talked about the rep range, 6 to 12 reps, hypertrophy, less than 6 with greater weight is strength. And then rest periods are critical, because you're going to overload your muscles and you're not going to get the benefit if you don't rest in between sets, in between days. Don't go lifting weights every day of the week. That's just not smart. And I want to tell you here, we're not covering cardiovascular training at all. Okay, I'm not talking about that, but I will tell you that I've never seen a marathoner that looks healthy. Okay, that's too much. And the brain, as Dr. Huberman talks about, the brain will tear down your muscles because it says, I need all of this energy because I'm running all the time. And so you're going to become sarcopenic by doing all of this. These are marathoners or people that do this to the excess. You run, you bicycle, you do yoga, you do these things on a kind of a routine basis. Fantastic. Include it. You need resistance and non-resistance training for optimal health. You've got to get your cardiovascular system going, and then of course, what does that do? It improves your circulation, and everything is better, right? Training variables. We're getting here to the end here. Frequency. How often do you do this? Okay, injury or current or previous. Avoidance. Avoid the the injury as you age. How do you do that? How do you make sure that if you decide to do a little bit of workout, how do you avoid that? Isometrics first, right? Let your muscles know what's happening. Let your connective tissue stabilize, your tendons and your ligaments. This is what's happening. I'm going to be using my muscles. So don't freak out and pop a ligament, okay? Pop a tendon. Do isometrics to get yourself going a little bit. And of course, it's based on, how often is based on age and gender. Your high school kid, lift weights every day, I don't care. And of course, the goals is desired shape and a status. Remember, I mentioned current shape. Everybody is in the right shape right now to start a program if you haven't, if you don't.
Hey, Doc.
Yes, sir.
One of the things I was taught was your body weight. Take care of your own body weight. You don't have to go to a gym. You don't have to deal with all the crap. Just take care of your own body weight. Deal with your body weight. If you could stand up on a wall and do your push-ups, or you could do regular push-ups, or you could do sit-ups, whatever.
Yes.
Do your own body weight, and it's
right.
not that easy.
No, it's not. And it's another great point, Joel. You mentioned push-ups. Hey, get in the push-up position and don't do a push-up. Just get in the position and hold it for 10, 20, 30 seconds.
Right.
Now you're using your own body weight. That's isometrics, and you're improving yourself. And you mentioned this, your own body weight. I didn't mention this, and this is important. Take your body weight goal. If you weigh 250 and you want to weigh 200, if you weigh 200 and you want to weigh 175, take your goal weight, and that basically guides you to 1 gram of protein per day per goal weight.
Wow.
So if you want to weigh 175 pounds, you need to eat 175 grams of protein. Whoa. Okay. A piece of chicken the size of your hand is probably 30 plus grams of protein. So now we're talking about eating 3 times a day, something like that. Or what do we do? What else do we do, Joel? Protein shakes. But remember, you're not getting 100% of the protein that's in there. So take that into consideration too. But I'm glad you mentioned use your own body weight. And I've got a thing on here that talks a little bit about that. Now I want to hit this we talked about recovery times, other variables for optimal results. Sleep, critical, just critical. I mean, it's so many things. And Dr. Clearfield, you did a fabulous job, and you talked about the time restricted, what do we call that?
Intermittent fast.
Intermittent fast. Okay. So I feel there's something different. Intermittent fasting is not time restricted eating. Intermittent fasting is going 24 hours without eating. That's a fast. Time restricted eating is going 20 hours, 16 hours, 12 hours without eating. That's not a fast. Okay. And there's a lot of benefits to everything, but that time restricted eating, I think, is extremely important for autophagy. Extremely important. But here's the kicker. And this is why it's different for everybody. And it's a balance. If you don't eat for 20 hours, in 4 hours, how are you going to get 100+ grams of protein? Right? So what do? Vary it. Vary it. You can go 20 off, 4 on Monday, Wednesday, and Friday. Tuesday, Thursday, Saturday, you might not do that. Maybe cut it to 12, but then you got 12 hours of eating the protein. And remember, when you eat the protein and stuff, it doesn't just go away. Your body will store this stuff. So you can do high protein on certain days of the week, and maybe you adjust your workout schedule based on how you feel, or your workout schedule, your exercise, your isometric schedule, because I'm really sensitive to what Dr. Patel said, really sensitive to this, because I am not talking about going to the gym. I'm talking about between patients and doing some isros. Before you go into a room, stand there and push on the doorway. See if you can push the doorway out. I do my isometrics in a doorway. That's how I do it. And then chair sit. That's how I do isometric. And they've got phenomenal things called the iso chain or iso strap, where you lift against resistance and it doesn't move. Okay, they got great stuff on this kind of thing. But this is where we need to really focus on this type of thing. And so if you're going to do time restricted eating, you're going to get that autophagy, but you may not get the protein. Get the protein the next day. Do something like that. If you are a devotee of time restricted eating, that's great. But I'm going to mind you, you better make sure you're getting your protein and your nutrients. And we are not talking about carbs and fats. That's a whole other topic. I'm just talking protein right here. And it's there, time restriction too. Supplements play a key in this as well. And the schedules, the cold therapy we talked about, and of course, breath work, very critical. You've got to have that oxygen. Okay. Real fast, ladies, I'm not going to go too much into this because it was kind of funny. A week or so ago, somebody did something on hormones, and then my topic came up, and Dr. Nario said, "Oh, we had something for the men. Now, I'm sorry, we had something on hormones for the women. Now Quinn's going to talk about something for the men." Okay, women too. And I will tell you, Dr. Patel, if you have younger ladies in your practice that have issues, right? They need to also do the resistance training. And as it says, the scientific truth about this is that not working out during certain phases of your cycle, the luteal phase, for example, right? When, having to do with your cycling, and people say, "Oh, you shouldn't work out then." Not true. Not true. Now, if you feel like crap, okay, that's different. Okay, that if your energy is gone or whatever, or you've got cramps, so, yeah, we're going to make adjustments for that. The point here is that ladies need to work out as well, and don't use anything as far as cycling as any type of excuse. And of course, a lot of this stuff comes from Dr. Gabrielle Lyon, who's a genius in this type of thing. And on the bottom here, right, the very bottom. Okay, there's birth control, and there's all that kind of stuff here that they do these studies on. It's incredible. So at the very bottom where it says, so while your feelings during certain parts of the cycle may change, low mood, fatigue, all that, your muscles themselves remain remarkably resistant. And then here's a couple of references on that, a few of them. Resistance training and all of that kind of stuff. This one used, I think it was like 43% of the participants were female. Okay. And then here's what the research says for women. Lift 2 to 4 times a week. Use, moderate loads for hypertrophy. That's what we talked about. Don't change the program unless you have a good reason. Fatigue, yes. Injury, overtraining, sure. But I might be in the luteal phase. That's not an excuse. Here's a whole little chart here on all the kind of stuff, and it doesn't point to the individual muscles, like on the right side, if you want to say protects against atherosclerosis, okay, it points to the heart. But otherwise, it's just generally, this is what happens, and it kind of shows where your resistance or your exercise training kind of comes in, okay? And then at the bottom, like delays aging. We haven't even talked about the psychological benefits of improving self-esteem and all of that kind of stuff. You look better, you feel better, your mood is increased, right? Muscles do all of this kind of stuff, right? You're basically, I would say your spleen doesn't have a lot to do with your mood, but your muscles do. And then resistance training of these are pearls of wisdom. Okay, prior to any workout regimen, and we have to say this, right? Good to get cleared by a cardiologist to make sure your heart can stand it. And then I put this in here, you know, like they always say, you know, check with your doctor, but get a physical from a physician who understands resistance training. I wouldn't go to somebody and ask them about an exercise program who doesn't seem to be into that and understand the benefit if they're obviously not practicing what they preach, right? Find a competent trainer. Trainers really vary. One of the reasons I like the podcast, and I'll show you, you know, just point out a couple of these people, is there are people here with PhDs in exercise physiology, nutrition, and all this kind of stuff who have trained 10,000 people, and they will tell you some of the things that bad trainers do and some of the things that good trainers do. One big thing is people go, well, I don't like to get sore. Well, no one does. A good trainer won't make you sore. The only reason that it's good to be sore is to let you know if you're working out the muscles, the correct muscles for the exercise you're doing, right? So if you're doing biceps and the next day your lower back hurts, you're doing it wrong. Okay. So you need to make sure that your muscles are in tune to what you're doing, and good trainers can do that. And then the gray thing on the top, like I mentioned, always good to mix your workouts, right? Do the ISOs, bands, weights, do it all, vary it, start low, go slow, use proper form to avoid injury. There's plenty of YouTube stuff now that shows you proper form. Be very careful to make sure that you only see things from credentialed people, not the latest, you know, burn fat guy, you know, V-shred guy. Oh, here's how you do it. I've trained stars. Yeah, I'm sure you have, but you don't have all the answers, and you never talk about form. And form is critical. So is flexibility. And then, of course, Mr. Tony Horton, don't know if you've ever heard of him, P90X. Stretching will keep you young. You got to stretch too. Don't forget stretching. So there's a lot of pearls here that we need. Okay, so age and shape is not an issue. These people on the left, I don't know how old you think they may be. I think you can understand that they're not in the greatest shape. They could use some muscle training. I do know that the guy on the right is in his 70s. I know that guy pretty well. And there's a little bit of muscle there. And hey, it's not 5 hours a week. Okay, it can be done. Okay, here's my podcast, guys. And I think this slide is very critical, this one and the next one, because these people know what the hell they're talking about. Jeff Cavalier used to be the strength and physical therapist for the New York Mets. Dr. Gabrielle Lyon, Forever Strong, great book. I got it, I read it. These mind pump guys, Sal DiStefano and his buddies here, 5 years. I mentioned Dr. Andrew Huberman and Huberman Lab and his scientific approach to everything. On the left, Dr. Mike Israetel is a maniac, was, you know, former Mr. Universe, he's a PhD. Dr. Andy Galpin, Build Strength and Stamina. He did a series with Dr. Huberman, who's on the left there, 4 or 5 part series on everything, including diet and how to train, when to train, and what to do. Mike O'Hearn on the right is Titan. He is a former Mr. Universe. This guy is almost 60, people. Look at his skin. He's too muscular for my taste and most people's taste, but do you think he's healthier than the 2 people I showed before? I think so. Okay. And then isometrics, Chris Thompson, the No Limit Squad, right? Here's a guy, and he's using what is known as an iso chain. That thing doesn't move that he's trying to curl and he's trying to lift, right? And I'm telling you, he isn't working out more than 6 to 10 minutes a day. And that's what happens. And then Dr. Lane Norton, right? Who says the magic is in the work you refuse to do. He studied under Dr. Don Lehman at in Chicago. I think it was it might be University of Illinois, might be Champaign-Urbana. Dr. Lane Norton and Dr. Gabrielle Lyon were all under him, learning, doing all of the researching and doing experiments back in the day on how to do all this stuff. Here's my last thing, and this is my favorite one. Okay, this is where we all find out where we are. Okay, and this is the testing. Can you do this now? Or how about when you're 70 to 80 years old? I'm pretty sure you think that Michael Hearn could do this, as he's almost 60 now, right? Can you lift 25 to 50 pounds over your head? That's everybody. Okay. Can you carry at least 2 to 4 bags of groceries, 50 to 100 feet? I put in women there because we love the women. Want them strong, want them healthy as well. Can you hold your breath more than 30 seconds? Can you stand on one leg for 30 seconds? And here's the fun one for all the men. Standing up, can you see your belt buckle when standing up, looking down? Or do you see your belly? And remember, I don't know if Dr. Clearfield said this or I heard this somewhere else, but I love this. The bigger the belly, the lower the testosterone, the higher the estrogen in men. Can you see your belly? And I'm not talking about a big cowboy belt buckle. I'm talking about a regular belt buckle. Okay? Can you hold yourself up on a pull-up bar for greater than 30 seconds? Dr. Miletus talked a big thing about grip strength, and there's a lot of information on grip strength, but it's not the only measure of health, overall health. It's very popular now to talk about grip strength, but I will tell you a personal example. My dad was a chef, and from lifting pots and pans, you do not want to shake that man's hand. He will crush you with his grip strength. But he was a smoker, and he was very, very unhealthy and didn't have a lot of I would say, overall health. But boy, did he have grip strength. Okay, so it's not the only end-all, be-all type of thing. What I like to find out for strength is this, and I think this is a better measure of it. Anybody who breaks their ankle, can you crutch around? That's overall health and strength, right? Because that's coordination, that's walking on one leg, that's balance, that's grip strength on the crutches, right? That is everything. That to me is a measure of health and strength. Can you do crutches? Okay, I think that's critical. Can you do 20 to 40 push-ups? Women 20, men 40 maybe? And then, or over 50 years of age men, can you do 40 push-ups? And this is all at once. It's not one every hour, okay? Can you do 50 sit-ups? Maybe 10. Can you hold a plank, horse stance, or a wall sit for 1 minute? Can you get up and down off the floor 10 times without grabbing something and holding? And we're talking, can you do this when you're 70 to 80? Hell, if you can't do that now and you're 50, where are you going to be when you're 70? Right? We got to get going here. And do you routinely, can you get out of a chair without pushing your hands? Can you just lift yourself up? Right? That's leg strength. That's core strength. That's everything. And then another proxy for your health, and get this, is twice your waist circumference in inches less than your height. So if your waist is 35, and women it's less, but for men, if your waist is 35 inches, let's say, I'm just picking a number, okay, and you double that, that's 70 inches, okay, that's 5 feet 10. You need to be at least 5'10" if your waist is 35. Does that make sense? Okay. And women, it's a little bit 0.8 to 0.9 because their waist size, generally is a little bit smaller. But think about that. So if your waist size is 36, you better be 6 feet. If you're 5'8", you're not in shape. Real simple. Okay. I hope I didn't guilt anybody into anything, but I hope what I did is kind of get you thinking, get you understanding the importance, the criticality of this, and start low, go slow works. Just do something. And remember, my goals at the very thing is lift heavy stuff. Pick up stuff and put it down. Do something like that to get your muscle health. And I'm sure the time is up, obviously, critically. So the hook is coming. If there's any questions or comments, I'm happy to go over those.
Well, I like the stuff part. We always like
Yeah. Well, you get that's my emphasis, right?
right, exactly.
Make sure that you do.
So Dr. Peterson has an interesting new book on ALS. There's a link in the chat if you need that.
Oh, good.
Dr. Nario has a recipe for something here. Is he still here?
No, that's the ingredients of Ensure. Why they shouldn't take
Ensure.
it.
Okay, yeah. It looks like good
That's
stuff.
my recipe.
Okay.
Oh
Looks
yeah,
like
the goodies.
I absolutely agree. I agree.
Yes,
I didn't know Dr. Quinn was so jacked. He's got a good physique.
he's looking good.
For an old guy, right?
I was thinking of Halasso, in your gym there when he was showing us that.
Right.
Yeah, he's now on the internet. He's showing off his physique too.
Yeah.
Cool. Cool. Stefan, I'm glad you're there.
What do you think of KATSU restriction bands?
I'm not sure about KATSU, but if you're
yes,
talking
dude.
restriction bands, and Stefan, feel free to jump in if you know, but anything that's a restriction band, if you use it and you use it correctly, it's got to help, right?
They're extremely strong. They're hard bands.
It's a strong band.
Yes, they're very strong. And
Okay, so that's like pushing against a wall. Walls are pretty strong too.
it is. It's absolutely amazing when you do it.
I love it. Anything that you can do, I'm telling you, half
Agree.
squats, brushing your teeth, just do it.
Right. Agree.
Okay, Dr. Nario, do you have any questions online?
Yeah. So it just made me kind of be motivated for working out because of my girly arms here. So thanks for that, Dr. Quinn. So,
No, that's okay. And again, I can't emphasize enough. Your patients look at
How
you.
many of us stood up and looked down to see if we could see our belt buckle?
Oh,
Isn't that a
that's
great one?
bad.
all right. So
Stefan,
here's
I know you can.
maybe for both of you guys. You always hear about taking protein. Is it best before or after workout?
After.
Doesn't matter. Everybody will say after. Okay. I wouldn't say don't take it before if you think it's going to provide you with energy. No, but as they say, if you take it afterwards, your muscles are going to soak that up. Right, Stefan?
Yeah, and you'll puke if you take a protein shake before you work.
Yeah. And you know this as a trainer. And I got to give you kudos. Everybody should be like Stefan's practice. I really think so. This guy does everything from the latest cutting edge treatments to emphasizing strength.
Yes.
Right? Everybody should be doing that.
Right.
Yeah.
And he didn't
I
pay
think
me to say that.
Yeah, you mentioned about the grip strength. We have a question here, but I think you explained a lot about facts about the grip strength. But it all, I guess, started with this marker of sarcopenia, as I think where Dr. Miletus was coming from. And again, you're right. It's not the only, as he alluded to, it's not the only marker of decline in muscle, but it's basically one of the better ones. Because I think another company out there is promoting it. It's a urolithin A product. So, but
right. From
I do agree. Right, that's right. So
now the guys. Oh, I'm sorry. The guys, the people that invented that as a proxy for overall health meant grip strength from hanging on a bar.
Yes, hanging on a bar.
Yeah, it wasn't. I mean, hey, when we have these conferences and all this kind of stuff, this is what I do while I'm sitting there listening.
My mom has been training hanging on a bar, so she'll do about 6 minutes a day of hanging from a bar.
Whoa!
Yeah,
that's phenomenal.
So it's 1 minute intervals throughout the day, so she does 6.
Perfect. That's perfect. So she's got good recovery time in there as well.
Mm-hmm.
Well, don't shake her hand then. She'll probably break mine.
She'll break your bones. Yeah, exactly. And again, I'm so glad what Dr. Patel talked about there because, hey, people are busy. Not everybody can do all of this kind of stuff all of the time and all of that. So you do what you can. You really do, but you have to.
And
Oh, I
Dr.
see.
Dr. Lewis, he's huge on grip strength. He's got these actual, I don't know, grip equipment that measures your grip strength. And he believes that it's absolutely huge to your health in the whole situation.
Well, I'll tell you what, when you talk about a measure of sarcopenia, your muscles kind of undergo a sarcopenic change. Certain ones are more than others.
Right.
And your forearms and your wrists and all that kind of stuff can go pretty quickly. And I think that's what they're talking about there as grip strength. And it measures a lot of things. It's not just, how strong you are. They use grip strength to measure a lot of things.
Agree.
Right. The thing that I work here in an office, like in the cancer center, what they did was they replaced chairs with, I mentioned this in the chat, with bouncy balls. So they're sitting on bouncy balls so they can actually balance themselves and practice core strength.
Right.
Strengthening during office work. So they're sitting there typing on their keyboard and trying to balance themselves out. So that's definitely basically the right proprioception exercise, balance, and as you said, isometrics are all there.
Yeah, it's perfect. That's wonderful. That's better than most. Another crazy theory that I have is you don't want the most comfortable office chair you can find because you want to be forced to get up and move.
No.
I can't keep sitting here.
That's right.
Good thing my chair is old, so
Perfect.
I just like stay away from it. They don't want to buy me a new one.
I train so much every day. I get the nicest gamer chair I can find so I can finally rest when I see patients.
And that, of course, you're the opposite of most people.
Like today, I'll give you what I did, and I've been doing this for the past 9 days straight. I've been practicing tennis at an academy 3 hours a day in the morning, and I see patients in the afternoon, and then I work out in the evening.
Perfect.
Man, that's the life. If you could have that schedule, I could definitely go into what you guys are doing. I'll make sure I send that to my boss. There's this Stefan guy who has the schedule. Why can't I get that?
It can work for me. I'll give you a great schedule.
Yeah.
All right, here's another one. So we see different body types. I mean, healthy body types. So there's a question here. What's healthier, a bodybuilder's built or a marathon runner's built? So
Without
those
a doubt.
type bodybuilder versus the bigger, muscular one?
Okay. First of all, if you're talking about a bodybuilder, we have to do, Stefan, you understand the term. We're only talking about natty people. Natty means natural. We're not talking about steroid enhanced. Okay. Most of those guys like Mike Israetel and Michael O'Hearn, that's steroids. We all know that. They know that. They admit to that. Right. I'm not saying it's bad. Okay. So if you're talking about a naturally strong bodybuilder versus someone who's tearing their knees up and their body apart running a marathon, I don't think there's any choice. If you're talking balance, do some VO2 max type of stuff, some of that endurance training as well as strength training. And Stefan will bear me out here. If you do a good workout with weights, man, you can be sucking wind. And that helps.
Right. And I agree with you there. I think that's the stereotype that people think about bodybuilding, that they use substances for that. But I have seen natural athletes just do this the right way. And there's no adulteration of any substances at all. So, but yeah, as you mentioned, the marathon runners, the problem there would be, of course.
Here's also the thing about being a natural purist. The adaptations to hormones with training is not the same for the 20-year-old as it is for the 60-year-old. So if you put a 60-year-old and you have them start a weightlifting program, their growth hormone doesn't go up, their testosterone doesn't go up like it would for a 20-year-old in response to the training. So, I mean, do a little enhancement. That's the whole point of anti-aging medicine. There's no reason to be a purist if your DHEA is, 90. Get on
Right,
some DHEA, pregnenolone at the very least, and then of
right.
course
That's what I do.
testosterone and it's and these are anabolic steroids. They have great therapeutic uses, especially for the aging patient.
Right.
Hmm.
Yeah. And that's why, again, there are so many healthier ways in how you can do this. You just need guidance, especially from the professionals and your medical doctor for sure. So here's another one.
I'm 57 years old, and it wasn't until I went to Dr. Clearfield that I got better. I had to have testosterone replacement therapy. It was just
Hmm.
as simple as that. There was no way I was going to start going to the gym and exercising, and I'm going to go blah, 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 and wah, wah, wah. No, it just wasn't going to work. So we interjected the testosterone replacement therapy right away. And I swear, as soon as I got the first shot, I got warmth back into my body. And
Wow.
it took a couple weeks, for the actual effects to start wearing in. But
Sure.
it was immediate when I got the shot. It was absolutely amazing. And that's what TRT can do for
Hmm.
seniors like myself who, have gone through a lot, especially as a Marine.
Sure.
I'll just be honest.
Yeah, no doubt. I mean, that's why we call it integrative medicine, right?
Exactly.
You use all of the tools that work that you need to make somebody healthy. They're tools, and like I said, that not one thing works. I mean, I wouldn't tell people that are ill, well, just go lift weights and you're going to be fine. No, but I would tell somebody who's got maybe a little thyroid or got some challenges there, exercise, and if you got to have the testosterone replacement, that's fine. You do what you got to do to get better.
Agree.
So another question here, I think, is you mentioned about lactate causing
Yeah.
all these soreness. So you're saying post-workout soreness, is that good or bad? I think it's pertaining to DOMS, delayed onset muscle soreness here. So they're probably asking, is soreness good immediately after, or is there something wrong with me if I feel soreness?
No, no. One thing I can tell you is you may have worked out too much. The person that goes, "Oh my God, I worked out and I can't lift my arm over my head." That might be a little bit too much. But again, the good thing about that is that tells you that whatever you were doing is working those muscles. And if those are the muscles you're trying to work, then that's the exercise that you want to do for those muscles. Just don't overdo it. Stefan can bear me out on this, but I will tell you, everybody's different. You're going to get
Yeah.
people that go, I'm not doing a good job unless I get sore. Okay, we
Well,
have those people.
the difference is when you get anybody on a first, if Dr. Patel decides to hit the gym tomorrow, right? She's going to be sore, and she's probably going to be sore for multiple days because she's never touched a dumbbell in I don't know how many years. Dr. Patel, have you ever touched a dumbbell? So she's going to be sore, and you have to anticipate this for the patient, and you have to warn them that they are going to be sore and that they're not going to die, but they do need to pace themselves and allow themselves to recover. But also, if the patient is having I would call it a pathological soreness, they're not recovering. This is days 3, 4, 5. It takes them like multiple days to recover. This is a sign that they have something significantly missing, and this is probably growth hormone, DHEA, testosterone. If
Sure.
they're having like pain and slow recovery, their hormones need to be looked at and they need to be optimized, especially your senior citizens who try to go and lift the weight.
Yeah. And you know what,
Dr.
Stefan, that,
Dr. Quinn, I have a quick question for you.
yeah,
We know that high protein diet does not build muscles.
correct.
What would be the optimal diet to build muscle?
That's where it goes back to if you are, let's say, older and you are sarcopenic and you are not doing anything, you are not doing any resistance training or something like that, you're going to want to try to focus on leucine. You're going to want to get a leucine supplement or something like that, because the amino acids are what's going to give you the benefit of the protein. And that's going to help your muscles more than anything if you're not working out. Okay. Now we can talk about, like I mentioned, 30 grams of protein per meal. If you're eating 3 meals a day, they find can help keep you from losing more muscle mass, but you're not going to build it with protein alone.
Are there any amino acid products? Maybe we cannot talk about that now. Are there amino acid products that contain leucine and isoleucine that
Yes.
can be used to build the muscle?
Yeah. And the one I know about, I guess we can't say anything. Dr. Clearfield?
We're still on. If you want, I can close it. We've got plenty here. So, okay. Good night, everybody.
Yeah.